So the case study that I decided to do is a man, Victor, who is 27 years old, and he is in the fight of post-traumatic stress disorder. Victor was an infantryman with the Marine Reserve Unit, and he was honorably discharged in 2014 after he served 2 tours in Iraq. His fiance reports that after his second tour, he did not come home the same. He started having relationship issues with her, as well as he started having sleep issues because of his duty. One thing that he struggles with now currently is he will not talk about his experience overseas. He feels like when he talks about it, it even makes him more irritable and ready to snap. With his sleeping, his fiance reports that he tends to sleep with one eye open, technically, meaning that he doesn't get any sleep because he's always thinking about what could happen. And even when he does get into a deeper sleep, he actually goes into very, very bad nightmares, which turn into night terrors of sorts, where he starts actually screaming in the middle of his sleep because he's thinking of those traumatic events that happened in his second tour. Another issue with Victor now is since he's came home from his second tour, he really just doesn't want to be around people. He'd rather spend time by himself just because he's very irritable and just doesn't want to snap at somebody. He finds it difficult right now to perform his duties actually at his job, which he is now a security guard. And in his job, it is very boring to him, which he reports because it is so boring to him, it actually gives him more time to think, which is bad because he thinks about his tour and the horror that he's seen in it. When he's at home, he actually is, even when he's not at home, he's startled by noises, and he spends a lot of time thinking about things that could happen or looking for bad things to happen, even when there's not even a threat around. He describes his memories as being very traumatic on a daily basis when he was on tour. And he doesn't even see friends anymore because of how bad it was, and it just reminds him of his time over there. So some of the symptoms he actually has is hypervigilance. He as well has intrusive thoughts. He tends to have a lot of irritability, as you can tell from this case study, and actually a loss of interest in things like, for instance, seeing his friends, spending time with his wife. As we talked about earlier, he has a lot of sleeping issues, as well as he just has trauma, which is probably his biggest symptom that he has. How would you treat it, you might ask? Well, for one thing that I think needs to happen is he needs to open up, and I think opening up to a counselor would be best for him, just because it puts him away from people he knows and doesn't want to see him in that state. And that's the thing that really bothers him, is agitating people or snapping on people that he loves. So I think talking to a counselor would really help. I really think that he also needs to go to support groups with people who have PTSD, where they can share their experiences, and he can see how other people who deal with the same things he deals with, how it helps them. I would also encourage him to exercise, find more hobbies at his house as well, to keep his mind occupied from the terrors that he's experienced. Overall, that is how I would approach his issue. I think the best thing is, like I said before, is really just trying to get him to open up and talk about it, because once I think that he talks about it more and realize that's his past, he will probably get over that issue. And I still think it'll be there with him, but I just think he'll be able to deal with it better is more or less what I mean. Thank you.